am Dr. Mehboob Fatima Siddiqui, MBBS MD, Associate Professor of Physiology in Paramedical College, Loni. So, in today's lecture, I am going to deliver a lecture on the topic of bone marrow. So, here after the completion of bone marrow topic, there will be a session in which I will solve the MCQs, important MCQs, multiple choice questions on this topic. So, let us start here. So, here in bone marrow, the student will be able to know after this lecture, name the types of bone marrow and give its functions, comprehend the basic cellular architecture of bone marrow, appreciate the importance of myeloid erythroid ratio in bone marrow. So, these are the must know areas. So, here the student may also be able to or desirable to know list the indications of bone marrow biopsy. So, here bone marrow biopsy, in which diseases there will be indication of this bone marrow biopsy. Understand the need for bone marrow aspiration. Describe the cellular patterns in bone marrow biopsy. So, bone marrow is the site of normal homeopoiesis after birth. See, this hemo means blood. Poiesis means formation. So, hematopoiesis means formation of blood. So, this is a Greek word hemo means blood. So, bone marrow, this is the site of hematopoiesis after birth. Before birth or in infants, the site for hematopoiesis is liver and spleen. So, when a woman is pregnant and the fetus, it is producing its own blood in the liver and spleen of the fetus. So, before birth, the site of hematopoiesis is different, and after birth, the production of blood is in the bone marrow. So, during fetal life, hematopoiesis mainly occurs in the spleen and liver. This is multiple choice question. And subsequently in red bone marrow present in the medullary cavities of all bones. So, this bone marrow, it is present in the cavity of the bones, medullary cavity of the bones. So, this is the this is a picture or structural organization of bone marrow showing different types of cells. So, note the presence of blast cells, progenitor cells, megakaryocytes, myelocytes and fat cells. So, red cells, they develop from, these are the special type of cells called erythroid nest. So, this red cells develops from the erythroid nest. So, this is the bone marrow. You are seeing the picture of bone marrow, and there are different type of cells, blast cells, lymphocytes, this small ink like colored small cells, you can see these are the lymphocytes. Then blast cells, progenitor cells, and these are the white cells you can see here, they are the fat cells. Neutrophils, that is neutrophil is the type of WBCs, and these are the vascular sinusoids, means blood vessels are there, myelocytes are there, and different types of progenitor cells are there. Megakaryocytes are also there. Then you can, from childhood, red marrow is progressively replaced by fatty tissue, yellow marrow. And normal hematopoiesis in adult is restricted to vertebrae, sternum, ribs, clavicles, pelvic bones, skull and ends of humerus and femur. Bone marrow contains a large range of hematopoietic precursor cells and storage pool of mature cells for their release into peripheral circulation. So, all blood cells are derived from the pluripotent stem cells. Pluripotent means there is so many, these cells, they have a potency to develop into different type of cells. Hence, they are called pluripotent. Pluri means more than one. They can change into more than one cells. Different types of cells can be produced by these pluripotent stem cells. So, they are called, referred to as hematopoietic stem cells. So, this is a special type of cells from which different types of red blood cells are formed and blood cells are formed. For example, RBCs, WBCs, platelets. So, these are three types of bone marrow: red marrow, yellow marrow and white marrow. What is red marrow? The red marrow is the active marrow and is red in color. It consists of many blood vessels that contain sinusoidal capillaries and the marrow stroma. So the marrow stroma consists of principally of a network of sinuses that originate at the endosteum from cortical capillaries and terminate in the collecting vessels that enter the systemic circulation. So hematopoiesis takes place in the intersinus spaces, and trilaminar sinuses walls contain three components, that is endothelial cells. These are the cells where this blood formation occurs. So these are different types of cells. C. Hematopoietic activity in adult life. Note, through the hematopoietic activity ceases in tibia. It stops in tibia and femur by third decade of the life. It continues in vertebra, sternum and ribs. So these are the site of blood formation. Which are the site of blood formation? Vertebrae, sternum and ribs. So after the age of 30 years, the blood formation occurs mainly in the vertebrae, sternum and ribs. Before the 30 years age, the long bones, femur and tibia, they are the main site of blood formation. Here in this slide, see, at the age of 20 to 30 years, red marrow of long bones stops to produce cells, and active marrow is limited to the membranous bones like skull bones, vertebrae, ribs, sternum and pelvic and pectoral regions. This is the MCQ here. So at the age of 20 to 30 years, the red marrow will stop producing cells, red marrow of long bones. So this is the picture here, you can see. So after the age of 30, the vertebra, sternum and ribs, they will continue to make the blood, and before the age of 30, tibia and femur, these are the long bones, they will produce the blood. So yellow marrow contains less blood vessels and more fat cells and fibrofatty tissues. So here the yellow marrow, it does not participate in hematopoiesis. So this yellow marrow, it does not take part in the formation of blood. Fat cells replace hematopoietic cells in the bones of hands, feet, legs and arm at about age of 20 years. Fat occupies 50% of the space of red marrow in the adult, and further fatty degeneration continues slowly with aging. Yellow marrow can revert back to hematopoietically active red marrow when prolonged demand persists, as occurs in chronic hemolytic anemia. So in chronic hemolytic anemia, there is more demand for red blood cells and all other cells of the blood. Hence, in this condition, this yellow marrow also will start producing the blood. So difference between red and yellow bone marrow activity. Red marrow, it is red in color and contain active hematopoietic tissue. Yellow marrow, yellow in color and inactive. And cellularity, red marrow, it has highly cellular matrix, that is contain all types of hematopoietic cells. Yellow marrow, very less cellular, contain more fat cells. In yellow marrow, there is more fat cells. In red marrow, there is less fat cells, but it is highly cellular and it contain all progenitor cells of the all progenitor cell for the formation of different type of blood. Site, red marrow in adult, it is restricted to vertebrae, sternum, ribs, clavicle, pelvic bones, skull and ends of humerus and femur. Yellow marrow in all other bones except end of long bones and axial skeleton. White marrow, see, this white marrow, it is found in the very old age. So in very old age individuals, a gelatinous transformation of fat to a mucoid material occurs in bone marrow. This type of marrow in elderly person is called the white marrow. So what is the importance of bone marrow examination? So bone marrow examination is indicated in complex hematological disorders and malignant hematological conditions. Malignant hematological conditions means cancers that requires detailed analysis of cellularity and activity of the marrow. So what are the indications? That is short note on this. What are the indications of bone marrow examination? It is done for the following type of assessment. For the assessment of cellularity of the marrow, normocellular, hypocellular or hypocellular, myeloid erythroid ratio. So see, these myeloid cells, they will produce WBCs, and erythroid cells, they will produce the RBCs. So for example, in leukemia, in blood cancer, this myeloid cell will be abnormally more in the bone marrow. So this can help in the diagnosis of blood cancer. So myeloid cells, they will be converted into WBC cells, and erythroid cells, they will be converted into RBCs. Then state of erythropoiesis, myelofibrosis and megakaryopoiesis. Then number of lymphocytes, normal, increase or abnormal, plasma cells, normal or increase, other cells, metastatic tumor cells, that is cancerous condition, parasites, for example, malaria, leishmania, donovani, etc., fungus or any other cells. If there is presence of any parasites or if there is presence of any cancerous cells, we can check it by examining the bone marrow. Iron stores evaluation by Persian blue reaction, normal, increase or decrease. Indication for bone marrow examination: anemias, aplastic anemia and refractory anemias, leukemic leukemia, that is the blood cancer. Differentiation of leukemias, different type of blood cancers we can diagnose with the help of this bone marrow examination. Myelofibrosis and myelosclerosis, multiple myeloma, agranulocytosis, megaloblastic anemia, thrombocytopenic purpura and assessment of iron stores. Therapeutic bone marrow transplantation, it is required in the treatment of blood cancers. So before that, we have to examine the bone marrow from the donor. What is the procedure? Bone marrow examination is usually done by needle, with the help of a needle aspiration and bone marrow trephine biopsy. So aspiration is a safe and easy procedure. So under local anesthesia, aspiration of biopsy needle is introduced into the center of the bone marrow, located bone marrow, and about 1 ml of marrow content is aspirated, or the tissue is obtained, which is examined after preparing a stained smear. So what is the name of this staining? Using by Romanovsky dyes. So what is the site of aspiration? It is sternum. This is the, here is the bone, it is called sternum. Sternal puncture, iliac crest and spinous process of vertebra. These are the sites. This is important. What is bone marrow needle aspiration? What is the usual site for aspiration are sternum, iliac crest and spinous process of vertebrae. So bone needle aspiration is relatively an easy procedure. Commonly used needle is Sala needle that has to provision of adjusting the depth of penetration into the bone marrow. External puncture, sternum, this is the bone here, and this is the most common procedure for bone marrow aspiration, especially in adults. These are the and other site is iliac crest and vertebral puncture. So examination of stained marrow smear is performed for assessing cellularity of marrow, effectiveness of homeostasis and presence of tumor cells or parasites for malaria. So which cells are present in bone marrow? This include stem cells, CFU. What is the meaning of CFU? Colony forming units, and blast cells, other progenitor cells, and the stem cells normally constitute about 0.5% of marrow cells. So here one important point I have to discuss with you. So in red bone marrow, cells are mostly of myeloid series that produces leukocytes, that is WBCs, white blood cells, granulocytes and agranulocytes. What are the granulocytes? Eosinophils, neutrophils and basophils, they are called granulocytes, and agranulocytes, monocytes and lymphocytes, and constituent about 70 to 75% of the cell mass. The erythroid series constitute about 25% of the marrow cell mass. Thus, the myeloid erythroid ratio is in the bone marrow is 3:1. So, this is MCQ. You have to remember this. See, in the what is the normal range of WBCs in the blood? It is 4,000 to 11,000. But the RBCs, they are in millions, 4 to 5 millions. So there is RBCs are very much high in quantity, and the WBCs, they are very less. They are in the range of 4,000 to 11,000. So the bone marrow, it is producing more WBCs as compared to RBCs. Hence the ratio is here 3:1. So in bone marrow, the progenitor cells for WBCs are very much high as compared 3 times high as compared to the progenitor cells for RBCs. However, in the peripheral blood, red cells are much more than the white cells. In the blood, the red cells, they are in the millions, and the white cells, they are in 1,000. Leukocyte erythrocyte ratio is being 1:7. So for every 1 WBC, there are 700 RBCs. So this is a very important thing. So application box, what is the importance? See, this myeloid erythroid ratio in bone marrow preserves leukocyte population in the peripheral blood. So the average lifespan of red cell is 120 days, whereas white cells stay in the peripheral blood for few hours to few days. Therefore, to preserve white cell population in the peripheral blood, nature has provided more white cell precursor in bone marrow. This more myeloid cells in the marrow help to replace adequate leukocyte in the blood, as leukocytes have shorter lifespan than the erythrocyte in circulating blood. So here the nature has provided this system. So more precursor cell for WBCs are there in the bone marrow as compared to RBCs. So here 3 times more precursor cell for WBCs are there as compared to this precursor cell for RBCs. 3 times more WBC cells are there. Scientist contribution. So this is the picture of this scientist, Dr. E. Donald Thomas. He received Nobel Prize in Physiology in Medicine in 1990 for bone marrow transplantation. So Dr. Thomas and his colleagues pioneered the successful use of bone marrow transplantation. This procedure replaces cancerous cells and stem cell damage by chemotherapy and radiation with donated healthy cells that engraft within the patient's bone marrow. So this discovery was cure for leukemia, that is blood cancer. This is the treatment for blood cancer and other blood cancers, leukemia and other blood cancers. And Dr. E. Donald Thomas earned the 1990 Nobel Prize in Physiology or Medicine. So this is a multiple choice question here. Remember the name of this scientist. He got the Nobel Prize in Physiology and Medicine for the discovery of this treatment. He discovered the treatment for blood cancer. That is the bone marrow transplantation is the treatment for blood cancer, and this was discovered by this doctor, Dr. E. Donald Thomas. What is this bone marrow transplantation? Is a process of collection and infusion of hematopoietic stem cells obtained from the bone marrow or peripheral blood of either of the other individual, that is donor, or of the own hematopoietic stem cells. So sources of hematopoietic stem cells, bone marrow. So here bone marrow is the richest source of hematopoietic stem cells, also called HSC. Peripheral blood, few HSC are present in the peripheral blood. Then umbilical cord blood collected following delivery. This is a rich source of this hematopoietic stem cells. So there is a short note on stem cells. So this is a important topic. Now I will discuss the multiple choice questions from this topic. So which of the following is not a bone marrow? So answer is green marrow. So green marrow is not a type of bone marrow. Red marrow, it is present, is a type of bone marrow. White marrow, it is also a type of bone marrow. Yellow marrow, it is also a type of bone marrow. But green marrow, it is not a type of bone marrow. So answer is green marrow. Which of the following is not true about red marrow? Contains active hematopoietic cells. This is correct. Highly cellular. This is also correct. In adult, restricted to vertebrae, sternum, ribs, pelvic bones and ends of humerus and femur. This is also correct. Contains more fat cells. This is wrong for red marrow. More cells, more fat cells, they are present in the white marrow. So this red marrow, it does not contain more fat cells. Next MCQ. Red marrow of long bones such as tibia and femur stops to produce cells by which age? So answer is 20 to 30 years. So by age of 20 to 30, the red marrow of long bones such as tibia and femur stops to produce cells. So this is the answer here. So answer is B. Who received Nobel Prize in Physiology and Medicine for bone marrow transplantation in 1920? So as I discussed earlier, answer is A. E. Donald Thomas. This is the name of that scientist who received Nobel Prize in Physiology and Medicine for bone marrow transplantation in 1990. Thank you. Subscribe our channel, share and give comment under the video. Thank you so much.